Welcome to another episode of the Wild and Well podcast. Today, we're talking all about osteopathy and how we can use this to benefit our families, ourselves, everybody. And with me, I have osteopath Tessa Lang. So, Tessa, before we begin, can you please tell us one thing that you did today to nourish you? So, something that you did to take care of yourself.
Yeah, absolutely. First of all, thank you for having me. I'm excited to be here. And one thing I did for me today was I actually woke up early with just my daughter before the boys got up and took some time to just kind of have a little moment with her, which she's the middle child. We don't get a lot of one-on-one time. So I did get up with her to start the day and just spend some time cuddling with her and reading with her and having that kind of time for just us to start my day a little bit slower before the chaos of all three kids got up.
That sounds lovely. How old are your three kids?
My oldest Brody is 3, my middle Danica is 2, and my youngest Adam is 5 months.
Wow. Oh, that's so lovely. She must have loved having that one-on-one time.
Yeah, it's really special for her because she's just always with one of the boys, so it's nice to have the one-on-one.
Yeah. So can you share a little bit about yourself and what it is that you do?
Yeah, so I am an osteopath and I recently specialized in kind of prenatal and pediatric care. So, osteopathy to start is manual therapy. It's hands-on treatment of the body, and it really operates on the idea that the body structure is completely interrelated with the body function. And so typically when we see discord in function, pain, pathology, illness, any of those things, it can be linked back to some kind of a structural discord in the body. And so, what osteopathy does is it works through the body as a whole, working with the collective mechanics and the integration of everything in the body in order to restore that natural ability to self heal, to self regulate, to normalize.
Okay. Yeah, that's a lot. That's osteopathy. It's something that I absolutely love. And I love coming, like full disclosure here, I go to Tessa. One of my kids goes to Tessa. Soon the other one will be as well. And I've loved osteopathy for so long, but I just can't explain it to people. I don't know why. It's like I just tell them that you guys are like working magic somehow on our bodies, and we always feel so much more aligned and healthier after.
Yeah, it is. It's a really hard one for people to explain. I hear that from my patients all the time. To simplify it, it's really kind of this idea that the ankle bone's connected to the knee bone's connected to the hip bone. Everything's attached and everything matters. So I find we like as human beings to have this concept that there's always one reason, there's one explanation, there's this is the problem. But really with the body, it's so much more complex than that. It's not one problem, it's everything. And so osteopathy, that's what kind of separates it from a lot of other modalities is it's looking to the entire body to find that root cause and addressing every little bit and piece of the problem and all of the body compensations that go with it. So when you have a shoulder injury, yes, the shoulder's the problem, but that's also now affected your posture and affected your hips. And so you have to focus on the whole picture to restore function.
And that makes sense because our bodies are all connected. Like if your shoulder's out, that is going to impact your hip and your knee and all those things, right?
Yeah, exactly.
Yeah, that's a nice way to describe it. So how did you get into working more predominantly with kids and mothers and prenatally?
So it was actually kind of my own journey into motherhood that opened my eyes to kind of the need for care in this field. So when I was pregnant with my oldest Brody, it was actually during COVID. And so everything was kind of locked down. There wasn't much available for care at all. And there were really no other osteopaths in the area. So I did zero prenatal care with him. And when we went into labor, I ended up having a pretty traumatic birth. I was quite injured through the birth. He was kind of not doing well at first. His heart rate was dropping through delivery. And it was just kind of a really low point for us those first few weeks postpartum because I had been so injured. I couldn't really walk. I couldn't really care for him. And he had a lot of problems. He was having trouble with latch. He was very colicky. He was just a very kind of unhappy baby those first couple weeks. And so I kind of realized, there's got to be something we can do to help correct all of this, to help make these things easier. And I knew that prenatal osteopathy was something that existed, but I had never really thought much about it prior to that. So that's kind of what started that journey for me.
It's interesting that a lot of our own experiences do really inform our career journeys, don't they? Like for myself as well. I was a psychologist before and I worked with kids and parents and but all sorts of different people. But it wasn't until I was a mom that I started really working predominantly like solely actually with mothers with their own mental health and then with their children's behavior as well. So yeah, it's interesting that that's what your story is. So did you end up using osteopathy for your other two births and pregnancies?
I did, yeah. So the first time I actually applied it in a prenatal postnatal setting was actually with my oldest, with Brody. We had been sent to sick kids because of his latch. He had a tongue tie, but there was a cyst on the tongue tie, and so in order to remove it, the surgeon said they would have had to remove one of his sublingual glands, which is a pretty major procedure. So he kind of gave me that initial push of he said to me, if you don't want to do this surgery, you're an osteopath. Why don't you try to fix it first? And then off I went, having never worked on a baby, never touched a baby, and I just kind of tried it out. And I was able to treat him. The cyst drained, and he was able to latch, and we never had to have that procedure. So that was kind of my first taste of doing it. And then yeah, I did get prenatal care at that point. COVID had ended. A couple more osteos had come to the area. I did prenatal osteopathy as well as massage therapy and pelvic floor therapy. And my delivery for my daughter was a dream.
Wow. So can you talk to us about how we can use this modality during pregnancy? Like how does that work and how does it benefit us? Because I think we'd all would love a birth that was like a dream. That sounds
Yeah, so really the reason to see an osteopath for prenatal, there's two big reasons. One, you want to make the pregnancy itself as easy as possible because anyone who's been through it knows pregnancy is not a walk in the park. There's lots of pains and discomforts associated with it. So one, it's to help with mom through the pregnancy. And then two, it's to help with the overall health of the baby in utero and facilitate more of a healthy, normal delivery. And so how we can go about that is if we can make sure that mom is in proper alignment throughout pregnancy, it facilitates more normal use of her body. So when you're pregnant, you have a hormone called relaxin that is building up in the body. And the purpose of that hormone is to allow the pelvis to expand as much as it needs to in order to facilitate the baby coming out. So it makes everything loose. It loosens all your ligaments essentially. But what that will also create, because it's not specific to the pelvis, the relaxin is everywhere in your body. So it creates this overall laxity in the ligaments through the entire body. And when that happens, the body will then be kind of predisposed to moving too much because you don't have that security of the ligaments. And so what typically happens is it will then respond by tensing up all the muscles to guard those joints that don't have the security of these normal ligaments. And that's when you get all of these pregnancy pains. I see so many moms with low back pain, with hip pain, with knee pain, with ankle pain. And it's all kind of partly in a big part because of this hormone relaxin that's creating this problem. And so how we can counteract that is by making sure that the body is in as optimal alignment as possible. Because as soon as you're out of alignment, you're now putting strain on the ligaments. They have to hold things in place. But if your force is being loaded evenly throughout the body, your back is on top of your hips are on top of your knees are on top of your ankle. Now the force is going through those joints properly. You don't require as much strength and support from those surrounding tissues. And so it really helps reduce the tension in the muscles, reduce the pain that you're having when the force is being used properly through the body.
so that helps mom during that time because she's not going to have as many of those niggling or like not even niggling, like some can be really major pain in different joints. Is
Yeah,
that
exactly. And even more focal pregnancy pain, round ligament pain is a big one that I see, which basically happens because the uterus is growing so rapidly. And what the round ligament does is it connects the uterus into those pubic bones, so into your pelvis. It basically tethers it to the pelvis so it doesn't just, float up into your belly. But as it grows, if there's asymmetry through the pelvis, if your hips are misaligned, now it's going to be pulling more from one side than on the other side. So I like to kind of think of it like if you were walking with your child and they're holding mom's hand on one side, they're holding dad's hand on the other side. But now all of a sudden, mom takes two steps away from the child. That's going to put a lot of pull through their arm. So that's what's kind of happening to the uterus and round ligament pain. You've got one pelvis in the right spot, one side of the pelvis in the other, in a kind of pathological spot, and now you've got too much force on one side, and so that's that shooting round ligament pain. So to level that out, we'll kind of correct that pain.
And is this something that you recommend? Sorry, is this something you recommend doing ahead of conception? Like, should women be coming in to get in proper alignment before conception? So then when they enter pregnancy, they're more likely to not have these issues pop up? Or is that not something we need to worry about? And it's more just like once they come up, we come in to see an osteopath.
It definitely can be beneficial to come even prior to conception for sure. Just for overall health and wellness, even for things like fertility. I mean, if there's a lot of structural discord in the body, if there's torsions and strains and irritating forces on the uterus, on those abdominal organs, on the communication of these nervous systems, the endocrine systems, that can, have play a big role in conceiving in the first place. And so it's great to kind of get into proper alignment kind of as early as possible. But that's not to say, if you're pregnant and you've never been for treatment, it's not too late. It's absolutely fine to just come and kind of start treatment once that conception has already happened.
So we can do it preventatively and we can do it kind of reactively as well.
Yeah, exactly.
Okay. And when you're talking about fertility and that preconception time, would people go to osteopathy specifically for that? Or can you just go and work on alignment and that's naturally going to help that fertility because things are in alignment? Or do you guys work specifically like on those reproductive organ spaces more so in that time?
So again, kind of both. I have definitely had patients. I actually had one patient who had adopted a child because they were told they could not conceive, and then had been coming to me just for general treatment for back pain, your typical work to desk job kind of issues. And then a few months later, she came to me. She was like, Tessa, oh my gosh, I'm pregnant. And they thought it wasn't even something that was possible. So sometimes it just kind of helps reset the systems and facilitates that without people even really coming in with that intention. I do have other patients that do come specifically with the intent of promoting fertility. So yeah, kind of either or.
Yeah. And what about for birth? How does osteopathy help us with having a more easeful birth?
So again, it kind of brings us back to this idea of proper pelvic alignment. So when we're talking about the birth itself, there's two big factors that play a role. There's one, the alignment of the pelvis and of the baby within the pelvic wall, and two, there's the ability of using your body to push efficiently and get that baby out in an effective manner. So that's like I always recommend to every single person I treat prenatally, you should at least do one session with a pelvic floor therapist as well before giving birth. Everybody thinks of pelvic floor therapy as being a recovery, but it's really best utilized to start before delivery because they can really help you learn how to use the muscles properly, do the proper exercises and stretches, and talk to you about, positions for delivery, things like that. So that's kind of taking care of the pushing side. And then my side that I work on is the alignment and the pelvic mobility, I guess. So as this baby comes out, the pelvis has to expand quite significantly to let the baby pass through such a small opening. And so it has to be level. If we have a pelvis that has a twist in it, one hip is forward, one hip is backwards, your tailbone's not moving properly, that can create kind of a block that the baby now has to move around in order to get out. And so that makes you have to push a lot harder. It makes the baby maybe hit the side too hard, and then you start to see tearing. You need for forceps or a vacuum, things like that. The other thing is the pelvis actually moves when you're delivering. It expands. People think of it as kind of one set structure, but it is multiple pieces, and those pieces are able to move on kind of a small level. And so we want to see that tailbone moving back to open up the space. We want to see those hip bones moving out to open up the space. And so having proper range of motion in those joints is really, really important, again, for opening up the canal enough that the baby can pass freely without getting stuck, without getting jammed, without tearing for mom, without injury for mom. I know for myself, I actually tore the ligaments in my SI joint, so the back of your pelvis, because I was so out of alignment that when I pushed, he couldn't get out, so he went back into my pelvis, and that's what kind of injured me.
Yeah, and all those things are so common in birth, aren't they?
Yeah,
Like,
absolutely.
So, are there other things we can do other than, I love that you mentioned going to a pelvic floor specialist or physio beforehand, because you're right. We all think about that as a recovery thing, but I wish I had done that. I wish I'd gone to osteo before as well. But I didn't, I was pushing kind of like my births were quite good, but I was pushing in a way that was inefficient. And I think probably
Yes.
pushing too much rather than listening to my body and tensing up a bit too much. So I wish I had learned those proper strategies ahead of time because I think it would have just been a lot more easeful and my body would have recovered a lot faster. But is there anything else that you recommend that we can do during pregnancy other than seeing a physio and seeing an osteo that we can do on our own to help with alignment and help to be ready for birth?
Yeah, absolutely. So there's a couple ones that are really, really big, but also very easy. So I would say breathing is super important for everybody, but especially during pregnancy. Proper deep belly breaths daily makes a huge difference because when we're talking about the ability to expel the baby, yes, the pelvis is important. It's the area that we have to kind of move through to get the baby out, but it's just the bottom of the container that's holding the baby. There's also a top, there's also a side and front and back. So the top of that is the diaphragm, and the diaphragm and the pelvic floor have to be working efficiently together to get the maximal effect of getting that baby out in a healthy, efficient way. And when we get pregnant, what happens as that baby grows, especially, is they're pushing up into our diaphragm, taking away that space. And so that diaphragm gets tight, those ribs get tight. A lot of us have felt it. It gets harder to breathe, you're short of breath, it's awkward to lie in certain positions. And so then when it comes time to push, you don't have a very functional diaphragm to be kind of that top of the box that's pushing that baby out. And so it's this discoordination between the pelvic floor and the diaphragm. Whereas if we're doing deep breath work throughout the pregnancy, making sure we're taking these big, long 4-second breaths in, a nice hold at the top, 4-second breaths out. It's exercising that diaphragm muscle the same way you would do your Kegels to exercise your pelvic floor muscles, so that those two muscles can work in tandem in order to expel that baby in a healthy, efficient way. The other one that I recommend to everybody is to do some kind of regular cyclic movement, whether that's walking, swimming, maybe not biking when you're super pregnant, but in the earlier stages, biking, anything that's kind of a full body movement that's allowing you to kind of integrate the body, level things out. Sometimes you don't need the kind of focal work of an osteopath to make a big significant change in the body. If you just continue to move it, the odds are it will kind of wiggle its way into a more efficient position on its own. The same way kind of that you do these big full body stretches, walking, swimming, biking, those are all things that are full body movements to facilitate more normal mechanics in the body.
Yeah, those are excellent ideas. And we do really think about birth being something that's more in our pelvis, isn't it? But
Mm.
really, like it's our whole body. That's just the bottom of it. I love how you describe that because I think that is not something we think about very often, is it?
Yeah, for sure.
So, how does osteopathy help our baby while we're pregnant? Does it help our baby while we're pregnant? Like, is it useful for them as well, or is that more for the mom?
I'm really glad you asked that because it's actually the biggest benefit of prenatal care, in my opinion, is the benefit that it actually gives to baby. Um, Probably more than half of the infants that I see within those first kind of early months of life, the problem actually occurred either in utero or during delivery. Because you think once they're born, they don't do much. They're not, running around, falling down, sitting at a desk all day, creating these problems that we would get as older individuals. So oftentimes their problems are kind of taking place in utero during development, especially in those later months of pregnancy as mom is getting quite large and you're running out of space in that pelvic abdominal area for the baby to move around. So when that happens, especially if your alignment is off, if you've got a compression on one side of your abdomen and then you're twisting to the other side, baby is now all of a sudden crammed into only a fraction of this available space that they should have. And especially as they get larger, that's going to cause them to contort their body and get kind of crammed up in weird positions that may kind of create problems, create issues, create restrictions for them once they're born. The same way as if you were, curled up in a ball with your neck kinked to the side for weeks on end, you would have a sore neck when you came out. Your neck would be restricted. You'd want to go and see someone to get adjusted. I mean, we even get that if we sleep wrong for one night. So to think that an infant in utero could be stuck in a certain position for weeks on end, and then we wonder why they're colic, why they're crying so much when they come out, probably because they've now gotten some kind of restriction that's stuck once they were born.
So by getting that proper alignment for mom, that enables the baby to more likely be in better alignment themselves because they have more flexibility with where they can move. Is that correct?
Yes, exactly. It gives them the space to have freedom of movement throughout the entire pregnancy rather than getting stuck in one position in one area. It
Mm.
also facilitates a better position leading up to birth. I mean, you see lots of babies who end up breech or sunny side up. And again, this is because they probably couldn't orient themselves into the right position. Whereas if there is enough space in the abdomen, if everything's aligned properly, they can move around, they can get themselves lined up with that head down in the middle position that facilitates them to come out more easily.
And if we didn't do osteopathy during pregnancy and we realize down the road that our kids have colic or even further down the track have misalignment themselves and various I don't know, behavioral issues or different things, is it like ideally we would have done the corrections in pregnancy, but are these things that you can address after the fact as well?
Yeah, absolutely. So, my recommendation is start as soon as you conceive, but it's never too late to start. I have patients coming to me that are 90 years old and we're still making progress, and there's always something that can be done. There's kind of a couple windows that it's like, if you get it in this time, it's going to be that much more effective. So if you can start prenatally, that's the gold standard. If you miss that prenatal window, the next best time is within those first 6 weeks of life when they're still super, super new and fresh and bendy, and there's lots that we can do. Those fontanelles on the head, so the soft spots that babies have, those don't close until kind of around the 12 to 18 month area. So anytime before then is really, really amazing to get them in because we can still have so much movement within those cranial bones. After that, anytime before puberty is great. At that point, they still don't have a fused sacrum. They still have mobility through those cranial bones. They're not fully fused. Your cranial bones don't actually fuse entirely until about 25 years old. So, any time prior to that, there's still a lot of potential for a lot of change through that cranial work. Same thing with your sacrum. It doesn't fuse, in fully into your 20s. Lots we can do there to make changes. There's also the factor of these growth plates. So bones, when you're born, are not fully ossified. They're part bone, they're part cartilage. They're still growing, and they have these growth plates that basically are where the bone will grow from as it grows. And those growth plates typically don't close until around the time you hit puberty. So for as long as you still have those and you're still growing, there's this massive amount of potential for us to make small changes that can then be magnified by the fact that the body is still growing.
Okay. So there that gives us hope for our kids and even for ourselves as adults that there's so much that we can do.
Yeah, absolutely.
And in terms of children, let's talk about them for a moment again. Do you recommend that people just go to an osteopath and get their children aligned and checked, even if there's no specific issues? Or are there specific issues that are red flags that you would think, okay, definitely bring your kid in for those? Or is it both, that we should do both of those things?
Yeah, absolutely, it's definitely both. I recommend to everybody bring your kids in for an assessment. Let's get them checked. Let's see what's going on. The same way that we go to the dentist for checkups every couple times a year, those teeth are attached to the rest of your body. So let's look at the rest of it, make sure the rest of it is lined up as well and working efficiently. And the reason for that is because in order for misalignment to be noticeable, kind of experienced as pain or as dysfunction, it has to hit a certain threshold. Everybody has a certain degree of misalignment in their body. That's normal. It's only once you hit a certain threshold of misalignment that you start to experience that as pain or as a problem. And so, ideally, if we can catch that misalignment before that pain threshold, we can fix it, and then that problem will never develop. We can kind of reverse it before you even notice it. And I do see a lot of adults people in their 20s, their 30s, even, 40s and 50s sometimes, where their issue is something that's been there for so long. It's been there since childhood, and they just never noticed it until those bones ossified fully, until they had these extra strains, and now they're sitting all the time or doing different activities, and then it becomes a noticeable pain. But if we had caught it earlier on, we could have corrected it, and they would have never known it was there. That being said, there's definitely certain things specifically that I would say if your child is experiencing this, definitely bring them in. So that would be things like digestive problems. That's one of the main ones I treat in young people, kind of from infant all the way through. It's a really important one because it does kind of have long-standing implications if it's not corrected. So a lot of times constipation in childhood or in infancy can kind of progress into things like IBS in adulthood. It can also influence the other body systems. So the colon and the bowels, they're right next to things like the uterus, things like the bladder. And so if we have chronic constipation in childhood, we see that colon expand and it starts to push on these other organs. And so it can also lead to dysfunction in things like menstruation and things like fertility and things like bladder control and bedwetting, things like that. And so it's a big one that really, if you're noticing any signs of constipation in your children, you should be bringing them in to get it addressed kind of urgently. And there's a lot that osteopathy can do to treat that because it is a physical structure in that abdominal cavity. If your pelvis is twisted, if your back has some kind of abnormal flexion or extension pattern, if your posture is off, all of these things are going to create abnormal force through that colon, through those bowels, and then it's going to restrict the movement of the fecal matter through there. And so if we can release those forces, release that tension, open up that pathway, it can allow for more ease of motion of the matter to pass through and to be passed as bowel movements.
That's
Um,
fascinating. That makes me wonder about how osteopathy can help with picky eating, even because constipation and gut issues is one reason why kids don't really want to eat and don't want to eat certain foods. So this could
mhm.
be really helpful in that case, potentially as well, with picky eating behaviors to reduce those.
Yeah, absolutely. And oftentimes people don't even really realize the extent of constipation in children. People don't know how frequent a bowel movement is normal versus abnormal. Some people tell me, "Oh yeah, they're not constipated. They go, a couple times a week." I'm like, "No, that they should be going every single day." Sometimes I'm treating children and I'll notice kind of anatomically that there's signs of a constipation problem and I'll ask mom and dad, do they have problems with bowel movements? Nope, no problems. And then they'll report to me, they come back that, oh my gosh, they've passed 4 bowel movements in the 24 hours since your treatment. And the child wasn't reporting any concerns. The parent wasn't reporting any concerns. But obviously, there was a huge buildup of material in that abdomen, which is, pushing on the stomach. It's creating a feeling of fullness that nobody even knew was there.
Wow. Yeah, I guess for the child, even it was probably just so normal. And for the parent, that behavior was so consistent for that child that they aren't aware of it.
Yeah, absolutely. And especially younger children, they don't have the verbiage, the knowledge, the experience to always articulate when something is wrong in the body. If they have had pain their whole life or constipation their whole life, especially these kind of chronic lower level pains, things like a low kind of lingering headache or abdominal discomfort, they may not even realize that that's abnormal. They may just think this is how the body is supposed to feel. So they never bring it up. They never mention it to mom or dad. And then it can create things like picky eating, for example, or like behavior issues as, they're irritated the same way we would be irritated if we had a headache. We're not going to respond as kindly to things. We're going to be a little bit more snappy with people because we're in pain and they may not have the proper verbiage or understanding to articulate that to us.
Yeah. So what are some other issues that you would suggest that if we notice them, we should be bringing our kids in?
Yeah. So other reasons that I see kids in my practice, aside from the digestive stuff, sleep and night terrors and nightmares is a big one. um, because of the relationship of the brain and the skull, and actually the jaw and the airway system. If there is misalignment through the head and neck, especially, it can really impact our sleep, resulting in a lot of wakings through the night, early rising in the morning, poor kind of sleep cycles. And when your sleep cycles go off, that's when you start to see things like nightmares, night terrors, as you're not going through those proper stages of deep sleep and light sleep. And that can often be linked to breathing when you're sleeping, nasal breathing versus mouth breathing, ability for air to pass through the airways. And so all of those things can kind of have a big physical response to correction of the head and neck alignment, allowing better sleep and improved night terrors, nightmares, things like that. Also with bedwetting, that can be linked to those same types of problems. Another one is obviously pain. If your child is saying to you, I'm sore, a lot of people will write it off as growing pains. But growing pains typically they shouldn't be happening often, and they shouldn't be happening consistently over long periods of time. So if your child is, 3 years old and already having growing pains, that's really young. That's too early to be having growing pains. If they've been having growing pains for years on end, that's not normal. So if it's a one-off, maybe chalk it up to growing pains. But if they're constantly reporting pain, that's a reason to bring them in. Um, and headaches, injuries, obviously, if they've broken a bone or they've had a fall, they've fallen down the stairs, they've fallen off a change table, things like that, you'd want to bring them in. If they're playing any sports, hockey being one of the worst, because they're stuck in this kind of asymmetric posture all the time on the ice when they're skating around with their sticks. So typically young athletes I do treat on kind of a regular basis to help mitigate that posture that they have through sport. Also things like gait and posture. So, walking with your feet turned out or turned in is a big one I treat in young people, that we can kind of correct the alignment of the hips to get them walking and running a little bit better. Jaw alignment. So things like if they're snoring, if they are trying to avoid orthodontic work down the road, if we can create more space, especially if they're in those early years, 2, 3, 4, before we hit the point of braces, if we can create more space and more alignment through the mouth, it may allow the teeth to grow in more straight and more effectively. Um, Also recurring illness. If you're sick all the time, you're getting ear infections every other month, you're constantly congested, you're getting a cold and it's lasting for a month or for 2 months, usually that indicates there's some kind of structural block to the body's immune system. So, especially in that kind of head and neck throat area, that has to drain into the body. It goes back to the heart. So when you have fluid in your ears, that's normal. There's fluid circulating through the sinuses, through the ear canals. That's healthy and normal. But if we now have no drainage pathway for that fluid, that gives an opportunity for bacteria to then accumulate and build up in those areas. So you can think of it as kind of a healthy body would be like a river, and an unhealthy body would be like a pond or a swamp where there's no circulation of that fluid, so bacteria grows. And that's when it kind of builds to this level of infection. And so if we can open up the pathway, release the ribs, make sure that the neck is properly aligned, get that lymph fluid moving, it allows better circulation of fluid in and out of the head to prevent the accumulation of this bacteria that's leading to these recurring illnesses.
Wow, this makes me want to take my kids in to see you like every week. I think we could all benefit from it regularly. And yeah, it's really interesting when you talk about like the airways and breathing, because that's something that I'm working on actively with one of my kids to open that up because he is mouth breathing and he is grinding his teeth and sometimes snoring at night. So we're really working to improve that so he doesn't have to have braces. And so he actually has like proper bone structure rather than just braces that are more for just like the look of them.
Yeah.
So that's interesting that osteopathy is something that we can really use in conjunction to that expansion work. That's fascinating.
Yeah, absolutely. Because it's, we think of the head as again as an isolated unit. We treat the jaw, we treat the teeth, we treat these structures of the face, but that head is sitting on the rest of the body. So if your posture is out and you're leaning forwards or you're leaning backwards, now your head has to readjust to that and you're creating strain through the muscles. And when you have this large tether from the musculature below the head that's feeding into the jaw, that's feeding into the skull, now that's going to kind of limit how much we can do with just focal work in the jaw. So it's really working with these lines of force all the way from the sacrum, the bottom of the spine, all the way up, because we want to create as much freedom of motion as we can before we get to the focal work in the head in order to kind of get the maximal effect. And that's why where osteopathy kind of really shines.
And are there other things that we can do to help our kids with the alignment? Like when we were talking about pregnancy, you're saying that breathing is useful and the pelvic floor specialist is useful and doing that cyclical movement. Are there things that we should be helping our kids to do that is it movement that is cyclical and rather than hockey that's really like one-sided? What do you recommend that we can do like in between our sessions to ensure or try to keep that alignment as optimal as we can?
Yeah, so the wonderful thing with kids is that they don't have these limitations that adults have in terms of we're stuck at a desk for 40 hours a week, or well, we have all of these kind of restrictions in our lives that prevent us from doing free movement. We don't just run around and play typically. But kids do. If you just give them time for free play, let them run around, let them jump, let them explore, let them use their body however they are inclined to, they're usually pretty good on their own at kind of using their body the way it's intended to be used just by giving them that free time of free play. Rather than sitting them in front of the TV or giving them the iPad, say, go outside, go play. Let them use their bodies however their creativity will allow them to. The other thing is limit things that are restrictive for them. So really what we're looking for is any kind of asymmetry. If they're always looking down at whatever is in front of them, whether that's their homework or at their desk or at their iPad or at whatever that may be. Not saying don't make your kids do homework, but have them do that for 15 minutes and then take a break. Let them do something that allows them to look up and to look around. If it's a baby, moms are really notorious for always carrying their baby in the same side on the same arm because we need our dominant hand to do stuff. But what happens when you're having a hold like that, always on the same side, especially if you're larger chested, which many of us are as we're breastfeeding, it's going to push their head to one side. And so they get stuck in this kind of posture of looking to one direction. And so switching up these postures, allowing them to be held on both sides or holding them upright so that they have freedom of movement in their head. The way that they sleep, again, as infants, they typically will always look the same way in a bassinet. And so they want to look at mom or they want to look out the window. So turn them in the bassinet, have their head at one end one night and then the other end the other night. So that encourages them to look in both directions. When you're sitting on the couch, people typically lean on one armrest all the time. We all have our spots on the couch. I don't know if that's normal in families, but my family definitely does. So encourage them to kind of sit in the middle or switch up the spots where they're sitting so that they're not always leaning to the same side. It's really any kind of asymmetry for a prolonged amount of time that we're trying to kind of identify and then correct.
Amazing. And in terms of our children's nervous system, how can osteopathy help support our kids with like behavioral issues or feeling like anxious and stressed?
Yeah, so there's a big physical role in terms of its effect on mental health. And so when we talk about, we'll use anxiety as an example. Um, we talk about that as most people who have anxiety would have what we consider a high sympathetic tone. So your sympathetic nervous system is basically your fight or flight response. So that, oh no, I'm in danger, something is wrong, I'm going to tense up my body and be stressed. And it's an evolutionary response that's supposed to be kind of very short term, short lived. But in today's society, where we have all of these kind of low level chronic stressors, it does become a more long term response. And so our whole body kind of takes on this guarding posture where your shoulders are up, you're holding your breath, all of your muscles are a little bit tense. And then what that does is, on top of this anxiety that may or may not have started as kind of a cognitive thing happening in the brain, it's now also being experienced through the whole body. And while the brain can communicate signals to the body can also communicate signals back to the brain. So it's constantly transmitting feedback from the environment to our brain. And so if our body has now established this sympathetic tone, this resting tension, it's sending signals back to the brain that something's wrong, I'm tense, there's a stressor in my life. And now that's being reinforced. And it kind of creates this like cycle, this loop of escalating each other. And so we can work on that physical feedback side to relax the muscles, release the tension, release the fascia, so that the body is now communicating back to the brain, no, I'm relaxed, I'm calm. And then the brain receives that feedback and will kind of process that information as well. And can help it kind of identify, oh, maybe I'm not stressed. There's through the T spine, so the area of the spine that's attached to ribs, there's what's called the sympathetic ganglia, which are basically kind of hubs for that fight or flight nervous system. And when those are being constantly stimulated, that will create more sympathetic charge through the body, more of that fight or flight, more of that stress response. And that can happen when the rib heads are out of alignment, irritating the portion of the spine where those sympathetic ganglia rest. And again, it's going to be that level of irritation, giving feedback to the brain that there's a sympathetic response. I'm stressed. And if we can release those ribs, release that spine, it takes that pressure off of those ganglia. It shuts down that signaling. And again, it's that feedback loop of once it's irritated, now you're not breathing as well because you're holding your breath. And so now those ribs are getting stuck there. They're not moving back into a normal place. And so sometimes you need that external force to come in and release and reset that system.
Yeah, this would work so well in conjunction with like the work I do, which is more like, well, the psychotherapy part of it, talking about things, working on breathing, stuff like that. But this body piece would be a huge helpful part in that because our brains and our bodies, they're all connected, aren't they?
Yeah, exactly. And I always will kind of, with my patients who are coming to me for behavior, for emotion regulation, for anxiety, I love working in tandem with mental health workers as well, psychotherapists, psychologists, whatever that may be, because it's kind of the idea of osteopathy is to treat the root cause of the problem. And with mental health, there is more to the picture than the physical side. It really is the two working in tandem. The brain is interrelated with the body. They're not two separate entities like we like to kind of play them out to be. They are completely one system. And so it's important to work at it from both sides.
Yeah, absolutely. I always find medicine and like even psychology included in that, that we do focus too much on one area. And that's why in the work I do, I bring in other components like nutrition and the environment and breathing and all these other modalities that are so important because it isn't just the situation or it isn't just the thoughts. It's so much bigger than that. And it's the body as well. That's a huge, huge piece.
Yeah, absolutely. Like we don't exist in a vacuum. We are an integration of everything, and it's super important to look at the whole picture.
So for kids and for like pregnant women and for adults, how often should we be going to osteopathy appointments? I imagine it's different depending on whether you're pregnant, whether you're newborn, whether you're a child, or whether you're an adult just going through day-to-day life. But what do you generally find is helpful for people?
Yeah, so you nailed it again. It very much varies by the person, by the situation. If I'm treating something specific, something where there is a very big problem, they're constipated, they have back pain, there's a concern that we'd like to see the symptoms be eliminated from in a timely manner. At that point, we're looking at typically about once a week until the structure normalizes, until the symptoms start to settle, and then we space out from there into more of a maintenance plan. For a generally healthy pregnancy, I typically like to see you in once a month, once every 6 weeks, somewhere in that range through the early stages of the pregnancy, to just monitor growth and development because so much is changing. We do want to kind of keep an eye on it. As you get into those later stages of pregnancy, the last trimester, and then especially those few weeks leading up to birth, we do pick up the pace to kind of bi-weekly or weekly, with the goal being that you've had a treatment within kind of a week of going into labor so that we can make sure that your pelvis and the baby is optimally aligned for labor and delivery. Because while normal out non-pregnant cases, we adjust the body and the body can kind of maintain that change. With pregnancy, we have this external factor of there's another being inside that's also moving around. And so the baby will kind of prefer one area or another and will throw mom out of alignment between treatments. And so that's why we do go a little bit more frequently in those end stages of pregnancy to kind of mitigate what the baby is doing. Um, once you're born, I typically like to see infants within the first 6 weeks of life. I like to see mom and baby both together so that we can deal with any pelvic misalignment that occurred during birth and also do an assessment of baby, make sure everything's looking good. If there's any concerns, we catch it early, we fix it, they're good to go. And then typically we check up on baby 4 times throughout the first year. So at birth, 3 months, 6 months, 9 months, at a year. And then from one until adulthood, for children, I usually recommend if they're totally healthy, no concern, coming a couple of times a year for a checkup. If they are kind of playing sports and doing lots of stuff that will create kind of a significant misalignment through the body, like a lot of my hockey players, I do see more along the timeline of kind of once a month just to mitigate again what they're doing when they're not here.
Yeah. Yeah, that makes a lot of sense. All those sports can really knock the body around.
Yeah.
Was there anything that I didn't ask that you wanted to mention here or that you thought would be useful for listeners to know about?
Um, I feel like we covered a lot, a lot of stuff. I think, yeah, the big thing is just that osteopathy is something that can just be part of your normal wellness plan, the same way as exercise or healthy diet is. You don't need to be sick. You don't need to have a problem to make an appointment. You don't need a referral. A lot of people come to me at the first appointment and they say things like, I don't know if I should be here. I don't know if this is the right thing to be doing. I didn't get a referral. Nothing's really wrong. That's okay. That's great. The time to really start, the best time to start is when you're healthy and when things look good, because that is, you're a clean slate and we can just keep an eye on it so that we can catch it in those early stages and it never becomes a big issue. And so I just want to make sure that people are clear on that, that it's not something that you have to wait until there is a serious problem to start.
I think that's a really good take-home message for all health modalities. I find that the same, like people come in to me and they say very similar things. I didn't get a referral. I don't think I have a specific diagnosis. Like I'm not crazy. All these things. I'm like, no, it's good. Like we all need support in whatever aspect of our life, whatever severity we're at, right? So I think that that's really, really helpful, whether we're working with a personal trainer or an osteopath or a psychologist or a nutritionist. Like we can all improve our situation so it doesn't get to that point of being like really, really bad and we're in a crisis and our body is so out of whack that we can't walk around properly.
Yes, like the goal is to be well, not to not be sick, right? So there's that kind of difference of overall wellness versus sickness.
Which is a mindset shift that is taking our society some time to change because we are very much in that sickness model. So yeah, if we can be preventative rather than reactive, that would be ideal.
Yes, exactly.
So where can people go to find out more about you and work with you?
So, I am one of the founders of the Well Body Group in Fenland. We actually now have a second location in Bobcaygeon. That's kind of our family center where we do most of our pediatric and prenatal care. We do have a website, wellbodygroup.com, if you want to check it out. We offer quite a lot of different services, again, because we really are looking at the whole picture. We want to make sure that when you walk through the door, you are being looked at as an individual, as a human being, not as your symptoms, not as your diagnosis. So we have massage therapy, osteopathy, acupuncture, reflexology, psychotherapy. We really want to kind of offer the whole spectrum of services to get people well and to maintain that wellness. So that's kind of where you can find us in our Bob Cage and our Fenland clinics online through that website. We have a social account, the Well Body Group on Instagram and Facebook. Um, yeah, that's kind of how you can get in touch. If you're looking specifically, if you're not local to this area, but this kind of resonated with you and you're looking to find an osteopath, there is a database online for osteopaths all over Canada. It's through the OstCan website. That's OSTCAN, short for Osteopathy Canada, OstCan. So if you look on there, you can search by location and find any registered osteopaths in your area as well.
Amazing. Well, I'll put all those in the show notes so people can find out more about you and your work. And also, that's really useful for people in Canada to find accredited osteopath. Thank
Yeah.
you so much for coming on here and talking about this. And I'm very motivated to book in our next appointment.
Thanks so much for having me.